Hello and welcome to The Why with Dr. T. This is episode 4 with Dr. Wally Shellenberger as our guest today. I am so happy that, Wally, that you're here and we're going to get to talk about all of the things that you've done, or some of the things that you have done over the last 50 years of being here in Orange County and some of the ways that you've really helped our community grow, whether you know it or not. But first, I want to start with a question of how do you know me or my family? What's the earliest memory you can think of?
Well, Brandy, when we worked together at Southern Hills Counseling Center, we would get difficult patients sometimes. Sometimes things got pretty rough, and the standard practice was you just had the police go pick them up. You were able to go with me sometimes to the patient's house and see them and talk to them there.
I forgot about all that.
And that you and I made a good team in being able to be where the the person could be listened to and
Yeah.
would feel free to speak, and we could a lot of times solve the issue there and not have to have hospitalization or
Yeah.
the courts involved.
That's right. I've you're right. I had forgotten about that and I think we did a good job at that time of least restrictive. I think we tried really hard to put ourselves in people's shoes and really try to do all the things necessary so that people can stay in their homes as long as possible and not go through that really difficult part of the mental health process. And sometimes it's unavoidable, but I think the goal should always be the least restrictive. And yeah, we sure did. That was I often tell people that if you're gonna get in the work of mental health, and then you should have a little bit of experience in community mental health because it'll teach you a lot. It'll humble you a lot and make you better at what you do. How many years did you spend there at community mental health?
Well, we came here in 1974. I think I started doing some mental health then, and I last worked at Southern Hills in 2008.
So it was 8 years that we worked together.
We were gone to Iran for 3.5 years during that time.
Now, were you also working at the health clinic
At the comprehensive
at
health care.
it was comprehensive at the time.
Yes.
Yeah,
Yeah.
you were
Southern Indiana Community Health Care, yeah.
yeah, yeah, doing kind of both.
Yeah, I was seeing patients there. I did general medicine for a while too, as well as psychiatry. When we first came to Orange County, we were invited to come because the physicians were all nearing retirement age. And the standard of practice at that time was if someone came into the emergency room, you just called the physician at home and he directed over the telephone what to do. And that wasn't very satisfactory. So the community wanted something different. So we came and we were pretty different, in a lot of different ways, from the community, from the other physicians. But we worked things out. Eventually, Dr. Hagen
Yeah.
invited us to work in his office for 2 weeks when we first came down so he could take a vacation. Dr. Schoolfield
Mhm.
gradually turned his practice over to Dr. Moseman, who was part of our practice.
Was my primary care office when I was a kid. Well, I know, I take that back, when I was a teenager, because back in the day, if you were a peds kid, Dr. Sarah in Bedford had a huge practice, and then as I got older, it was Dr. Mosman's office in Orleans.
And Dr. Clark, he was on our board of directors for Southern Indiana Community Healthcare for a while. So we began to develop relationships and have good communication and hopefully helped in the medical services for the county.
Well, I think you did. I think that, unfortunately, we're still having trouble with attracting physicians here. I think that that 50 years ago was the solution, but I think as times went on, we are back in that similar spot with physician recruitment. It's been really hard to get physicians here. I I wish that there was something like that now, because I think we need it in these rural communities with physicians. We've done a wonderful job at growing nurse practitioners here, but it is that physician piece that is we're rolling around with some trouble again. But it's one step at a time. But I think the story of those physicians coming here is interesting. I think that it also planted the seed for so much in the medical field, and not just the medical field, but of a lot of the things that are good that are going on in Orange County. But how many came? How many was in that original kind of group roughly?
Well, the original group was Terry Knopfziger
Yes.
and his wife Mary and Evie and I. And then within a few months, Jan Krupp joined us as a nurse practitioner. Then Dr. Graber began to work. He worked part-time here and part-time in Indianapolis for a while. And then within a couple of years, Luke Mosman joined us. And Eric Lehman,
Yeah. My mom used to work in the emergency room with Dr. Lehman.
as the years went on, Don Troyer joined our practice.
And when did the Beachies come in?
And Dave Beachy joined, I don't know the year, probably 30 years ago at least,
Yeah.
in the 80s sometime down there.
When I was doing emergency room psychiatric consults, Dr. Beachy was there all the time. That's who I remember the most. And he just did so well with patient care, with understanding the the culture, the people, in this area, and that relationship, I think, um, makes for somewhat better outcomes or can.
Mm.
And then, of course, Dr. Phil and Yolanda, at some point, I always thought they were the original group, but they weren't. I mean, you know that if you do the math, but it just feels like there was such a wave of physicians that came in over the course of those years, and they all seemed like they were kind of connected, and they weren't just connected medically. They were connected to a lot of other things. Like one of the things, our Habitat for Humanity that I know of, the community gardens, all these. I'm not even naming all of them, I'm sure, but where the seeds were planted because of a core group of a few people chose Orange County.
Yeah. Yeah, it's been a nice place to live. Nice place to share with others. There are differences. It's important to 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 see the beauty of differences rather than the negativity. It's important to listen to people across different lines. I know when the Gulf War broke out back in 1990, we were at a ball game once, and they announced that everyone should stand up in support of the troops. Well, we stood up, but then afterward, we thought that really wasn't honest. So we wrote a letter to the editor saying that we stood in support of the men and women, who had to go fight there. We didn't stand in support of the war. So we wrote a letter to the editor explaining that. And we got a call from some elected people in the county saying that they really appreciated us being specific and hopefully we weren't put in any difficult position because of it. So it's really good to listen to each other and find chances to non-confrontationally express your point of view.
I didn't know that that letter was I didn't know that story, so and then our local officials were making sure you're okay.
Yeah.
That says a lot of things about the community. I think that
It does.
yeah, that you well, number 1, you felt able to do that, but number 2, that the response of the elected officials was, "We understand." And it sounds like that was more of a it's a bad situation for everybody, and we
Yeah.
understand that, and we also said that the folks that are over there doing the work that they signed up for is important, but it's the reason sometimes very complex and difficult. But you end up traveling to or living in the Middle East, right?
Oh, yes. Evie and I lived
Eventually.
in Iran for 3.5 years. The tensions in between Iran and the United States were kinda tough, and our church had an exchange student program, and so we went as students there, and some Iranians came to North America as students, kinda building relationships that way.
So, I remember when you and Evie wrote your book, and then we had a little bit of a celebrity signing book review at, PMF, and we went that day, and I have the book over there on the shelf that you signed. Um, but one of the things it's weird the things that you remember, but I remember when you and Evie were there talking about your experiences and talking about the book, and really it's a lot of the misconceptions that we have about people and about cultures and, different things, but I remember walnuts and figs were served, and I think you talked about that, how, there's something about the walnuts and the figs, but they were served at this book signing. It's just a weird thing that you remember, but
Or is it walnuts and dates?
no, it was walnuts and dates, you're right, it wasn't figs, it was walnuts and dates, and I thought, "What?" I don't know, that's just a piece of a memory. I don't know why, but
They would during the month of Ramadan, and that's the month of fasting, and in the evening when sunset comes and they can eat something, the first thing they eat is the date and the walnut. They cut the date open and stick a walnut inside.
yes, that's what you were showing. Yes, I remember that. Why is that though? Did they what's the
Well,
is it just
I don't think know there's any deep reason for it. It's just a way of breaking the fast.
to me, I think that it is incredible that 2 people from Orange County can go to these places that most people never I can't even pronounce right, but let alone go there and live amongst different cultures, learn about different perspectives, and then come back here and are able to talk about those experiences and shine a little bit of light on something different, something maybe bigger than us or something. And I think that that just plants the seeds of connection.
Yeah, well, even there, I mean, one time Evie and I were visiting with a group of university students, and they became aware of the fact that Evie and I really knew Islam pretty well. And one of them said, "Well, now that you've gotten acquainted with Islam and you know our stories and you know the truths of Islam, when will you be becoming a Muslim?"
What did you say?
And I said, "Well, while you're waiting for me to become a Muslim, I am, because of Islam, becoming a better Christian." So,
And and how they receive that.
hope they liked that.
That was the perfect answer.
But it's a way to, rather than emphasize the difference, it's a way of showing the benefit of both. It's true. Coming back to the States, we were able to tell stories and help break down stereotypes. But even in Iran, we could do it too.
'Cause, we talk a lot about stereotypes. We talk a lot as anymore and about it being an American thing, but really it's not. I think it's a human thing to have these barriers. And but it's also very human and it's also our responsibility as humans to work on breaking those barriers down, seeing differences as a positive and working towards something more, to bring out the best of that human nature.
Yeah, I know. And that takes some listening, some careful listening sometimes. I remember I had a conversation with a guy once. He didn't have a refrigerator and he needed one badly. So, you know what I did? I found a refrigerator for him. But the next time I saw him, he was angry with me. And he didn't say why he was angry, and I don't even know if he knew why. But he was just down on me on everything. And I listened carefully to him. And what I heard was that he was angry because I gave him essentially a refrigerator. He needed a refrigerator, but he didn't need someone to give it to him. So I listened to him and heard that from him. And that's made me more careful to listen carefully before you jump in and try to be a goody do-gooder for people.
Well, how would you have done that differently?
How would I have done that differently?
Yeah.
Hmm, I would probably have been more indirect.
There's this refrigerator over here that this guy down the street says he doesn't want anymore. Like, what do you think about that? You know,
Something like that.
or there's some yard work that needs to be done, and this guy will pay you in yard work, in a refrigerator.
So it wasn't just his problem, it was my problem too, and being able to communicate effectively with him. So I learned from that. So the more we can listen carefully, I think, and watch out what I think is best, and things go better.
Out of all the years that you've been here in Orange County, what is the one or two things that you feel you've really made it hopeful you feel like you've made a difference?
Oh, that's hard to say. Because we're just all in it together.
Yeah.
I mean, I do my part, the other people do their part, and gradually things get a little better, maybe. I don't know. I don't know that I had any great big or any big part in anything. Or I don't know that I can point to anything except except that there is health care here, and we did help sustain that.
Yeah, and I think that you also have some pretty good family members who also, in their own way, carry on those good community relationship values of teaching teaching people, growing people, helping people, you know,
Yeah, our son is
proud to
good at
talk.
that.
Yeah, and he really is. That whole family is good. And I think sometimes we don't realize how much people are paying attention, and what effect we have on people. Um, so I think that for me, because I try to know that, I think every interaction that we try to have ought to be as beneficial as possible and as kind as possible. And because we never know what people take, and whether that seed that grows is something positive or something negative. So I think every interaction that we have with people, we should try our best to make it be okay, yeah, and favorable as much as possible. And I feel like that's because I've not been around here. I've been around here 30 years. And in that 30 years time, the things that you and Evie do that you probably don't even realize people are watching, is the reason why I wanted you guys to be the first guest, is because of that. For me, the 30 years of watching your role in a much bigger picture of the community has been very important, and probably more important than what I think you would even know. That because I think that the work that you 2 have done has made people's lives better without even knowing it.
Well, there's this quote that says, "No kind deed is ever wasted."
I think you're right, and I think too that our first encounter kind of with each other was community mental health somewhat, and when I look back on that, you were the staff psychiatrist, and I was, coming right out of my bachelor's degree and, didn't have a lot of awareness or understanding. We're just growing up, and I never felt small. I never felt inconsequential. I never, when we were working together with clients and with that whole mental health system, which can be pretty difficult to navigate, I never felt beneath. And I've always thought that was so important. So, I appreciated that. Felt like I knew what I was talking about. I felt like you knew, even if I didn't know what I was talking about, you didn't, at least wasn't rude about it. When we were able to really kind of work together, and I felt like we were working together for the common good of whatever client or patient that we were taking care of or trying to take care of at the time. And that's always kind of stuck with me. And then I think fast forwarding, whenever I started to go to PMF with the kids, I think that was just another insight, another, way of understanding the importance of relationships.
I think another thing that I think of is that I got identified as a Democrat somehow. I didn't never thought of myself as a Democrat or part of the Democratic Party, because when I voted for whoever I thought was the best person. But maybe it's because I went to PMF or maybe some other reason, I don't know. Someone asked me to represent the Democratic Party, during the election, to be a poll worker.
Oh, yeah. Yeah.
And so I was happy to become a poll worker. Uh, And that was really a good experience in listening to other people, s seeing, how other people see things and understand things. And I became really good friends with there's the clerk and the judge, and then there's the one that's higher than that. What's
The
that?
inspector.
The inspector,
Mhm.
yeah. I got really good friends with the Republican inspector because the inspector and one of the judges from the opposite party had to take the stuff down to the courthouse,
Yes. Yeah.
and, that was really a good experience to become good friends with the inspector.
You've done that more than once because I have worked almost every election, whether that's uh, a primary or a general, since about 2007. And I remember seeing you carrying the boxes, the totes of all the machines up to the courthouse. And sometimes I think we were in the same area together, maybe on a couple occasions. I'm usually in Orleans, but sometimes I was in Paoli, and I think you were usually in the Paoli community building.
They were usually.
Yeah. Yeah, that's right. And I always enjoyed working as an election worker because it was almost like a reunion. I mean, I had fun all day long. It was 12, 13 hours of seeing your neighbors. Now they'd sometimes give you a ribbon or a cursing or tell you, how wrong you are. But usually it was some pretty excellent conversations. And it was really checking in on all the kids, checking in on the neighbors, seeing how the dog's doing. And it has always been a good experience working the elections. That's right, you worked them too, you and Evie.
Yeah, I felt a little bit out of my element to start with, but it was a good experience.
Yeah, it was because it's about relationships.
Mhm, that's right. Working together for the common benefit.
Yeah, you're right. And on that note, I think it's good for us to end our episode. Time flies, but I appreciate you being here. There's so many things, so many other things I'd like to talk about, but, you know, time's up.
Thank you.
Thank you for being with us. And that ends episode 4 of The Why with Dr. T. Thank you so much for joining us.
It's the